I have to stop you for a second because we lost the live stream to YouTube, and
Yeah.
and we're not streaming on Facebook. It just popped out. It just stopped working. I almost think that they didn't want us to do it because I have been. Well, we're supposedly live on YouTube, so let's keep going.
Okay, so I ended up in Cleveland at one of the university hospitals there, and I was an internal medicine, a resident in internal medicine. And I'd read the newspaper every day, and it seemed that people were eating poisonous mushrooms, which kill their livers, and they were dying, and no one knew what to do. So somebody knew my wife, who was a pediatrician, and she knew that I had a PhD in mycology in addition to my MD, and she wrote a bit in the newspaper that Dr. Berkson knows what to do. So the people at my hospital, at my teaching hospital, got very angry. They thought I was going around telling people that I knew what to do, and they didn't. So all of the new people who were getting poisoned by mushrooms, which killed their livers, were put on my service. And I was told, let them die on you. Well, I had known Dr. Fred Barter, who was the chief of National Institutes of Health, several years before, when I built an electron microscopy laboratory. He he was instrumental in getting me the grant to do this, the $500,000 to do it. So I called him up and I asked him, is there anything in the world that you know of that might regenerate a liver when it's been damaged? And he said he was studying alpha lipoic acid. It was called thioctic acid. That's the brand name.
Now, wait a minute. This is way back in the 1970s?
1977. He said he thought that alpha lipoic acid might be the treatment for all liver disease, but he was getting nowhere with it, even though he was the big chief with our government. So he sent me a couple of cases, and I was told I couldn't use it because it wasn't on their formulary at the hospital, but I used it anyway and injected into these patients who were dying of liver disease. And within 2 weeks, they regrew their livers. I was amazed. And then Dr. Barter came out to Cleveland with a group of scientists from NIH to study the patients. We had several by then, and to also set up a national conference on the regeneration of livers. And he asked me to be the lead speaker. Well, being a lowly resident, the liver experts at the university became very angry that he didn't ask them to speak. And the chiefs became angry. They said, how did he ever allow a resident to be the chief speaker at this big conference? He must be going senile. Well, Dr. Barter and I, right after that, were invited to Germany to be visiting professors at one of the big, it's Max Planck Institute in Germany. And we were there for a while, and we wrote, I guess it was 2. And these papers were published. And when I got back to Cleveland, they told me I can't talk about this anymore in Cleveland. They were interested in liver regeneration, and this might interfere with the liver regeneration business. But I kept doing it anyway. We published papers in 79 people all across the country, big hospitals all across the country, with acute hepatic necrosis, which is almost dead livers. Today, they'd get a liver transplant, but it was difficult getting one in those days. So we gave them alpha lipoic acid, and within a full month, 75 out of 79 regenerated their livers. I wrote a note for the New England Journal of Medicine, which is published. And I got a lot of criticism. They said, "You're not a liver expert. What right do you have to do this?"
Now, do you have that research report now? Because I remember 10 years ago, that research report was not available. The 79 people, 75 out of 79 healing.
It's on Google Scholar.
Okay, so if anyone wants to see this, because I got bashed years ago, you know, when I told people that I healed the, and I wrote the book, and people would say, "I want to see the research." I'm like, I can't give it to you. So now everybody go to Google Scholar and type in Dr. Burt Berkson, or is it Burton Berkson?
Burt, B-U-R-T.
Berkson,
B-E-R-K-S-O-N.
Right. And so look that up, because I want people to take the science to their doctors so they can understand. I am not kidding. I followed a physician, MD, PhD. He was able to, and they haven't even put this on a protocol yet.
Well, it's only 40 some years. I don't know if you read the foreword to my book, The Alpha Lipoic Acid Breakthrough.
Yes.
Where Dr. Whitaker wrote. He said that, you know, one time I thought if something new came along and was really effective, within a short time, all doctors would pick it up and become standard of care. He said, now that I've been practicing for 30 some years, I realize that most doctors would rather have their patients die than do something different.
I tell you, it's unfortunate, and we want to think that doesn't. We want to think that the guys and girls, women also, who are handling these kids, and because I know you take only adults, but I have helped so many children just by putting them on your protocol and taking them off the bad diet, and people are just not getting it. And I have to tell you, unfortunately there's one kid that I tried to help. And in England, it's very hard to help overseas, but I have a lot of people healing overseas. And the mother just wouldn't listen to me, just got scared to death. The doctor told her not to give that child Silymarin. It would hurt the liver. This is what the doctor told the child. And the child's bilirubin was enormously high. It was like in the 30s. How do you speak to that when the doctors don't listen?
Well, you can't make people do it that they don't want to do. And, you know, most doctors are afraid to do something different because they you know, when I started medical school, this really bothered me. It was like the military. People would, the residents would follow the attendings around. The attendings would follow the chief around. I remember I used to get into the elevator all the time before the chief. And they tell me to get out and let the residents go in first, and then the attendings, and then the chief, and I wouldn't do it. And I just didn't fit into this kind of stuff. But this is the way they are. They're very concerned that somebody above them might look down on them because they do these things, doing something a little different. But being educated as a PhD, you know, you look at things differently.
Right.
You look at things like a scientist rather than an MD. MD is mostly getting trained. A PhD is education.
Right. So go on with you went to, I just want you to continue with how you healed these people and how you were able to write this paper. And it was in Germany for quite a long time, for 35 years or something. It was published in Germany.
No. You could get it here. It's in English though. So
now it is. Yeah.
And by the way, I also wrote a paper on the reversal of hepatitis C with cirrhosis in the German Journal of Internal Medicine, one of the most prestigious journals in the world.
Right.
It was completely ignored in America, all in English, by the way. And if you go to PubMed, you know, the National Library of Medicine website,
right,
and you type in Berkson BM, like Martin, BM. That means beautiful mind. You type in BM, you'll see several of my publications. But on Google Scholar, you see a lot of publications in biology and medicine and all sorts of things.
Okay.
So anyway, I was discouraged from doing this kind of research, and it got uglier and uglier and uglier. Fighting constantly with people. They did all sorts of things to make me look bad.
Mm-hmm.
And
Yep.
then I just got fed up with university work, and I decided to become a country doctor
Mm-hmm.
in New Mexico in a little town called Lovington. And I was a country doctor from, let's see, from 1980 to 1986. And then I did a few other things. I became a medical director of a big HMO until I found out what an HMO was, and I walked out.
Why?
And
What was the HMO?
HMOs, I'll tell you in person someday. Some of the
Okay.
stories.
Okay. Okay. Yeah. Not now.
I would never join an HMO. Let me tell you that. Then I decided to move back to New Mexico, and was an emergency room doctor for a while. And then I decided to open a little practice, and it became a very, very big practice in Las Cruces, New Mexico. People come from all over the world.
Right.
We treat a lot of liver disease, all types of liver disease, and we have very good results. And we treat, we discourage cancer patients, but I have several publications on healing different cancers, and as long as they're in the treatment program, many people do very well. We have tremendous results with diabetes. We reverse diabetic neuropathies and complications all the time with intravenous alpha lipoic acid. If you go to PubMed and you type in alpha lipoic acid, diabetes mellitus, see thousands of publications. The research has all been done, but it's not on the market. It'll probably never be on the market. Guess why?
Why?
Because it's a natural substance, and it's very cheap and very available, and nobody makes big money on it.
And not only is that so here's what's going on behind the scenes that you are not aware of. Facebook bleeped us out. Just doesn't want us to talk about this. I really believe that's so. At first, YouTube bleeped us out, but we got back on. I think that when we start talking about how to heal naturally, the ethers hear it. Somebody is listening, and they went boop, and they cut us off Facebook. So hopefully people will find us on Facebook, on YouTube, and that's okay, because I can replay it on Facebook later on today. But so we won't get live questions. But I want you to go on and tell people, you said it's a natural substance. Tell me where it comes from.
Well, every cell of our body, every normal cell of our body needs alpha lipoic acid.
Right.
And we produce it in very small amounts. Lipoic acid, what changes our food into energy in the mitochondrion, the energy factory of the cell. Now, cancer cells are mostly anaerobic. They don't grow with oxygen, and they often don't have functional mitochondria.
Right.
So if you give a lot of alpha lipoic acid to a person with many cancers, you force the cancer cell to go from anaerobic metabolism into an oxygen metabolism, and they tend to die from that.
There you go. Killing those cancer cells.
And also for liver disease, lipoic acid stimulates regeneration of liver cells.
Now, didn't you write a paper on that? Cancer and liver?
I wrote lots of papers.
But there was one specific one when you came to, in 2018, to the first symposium I had, and you can catch this on, you can catch the 2019 symposium on YouTube with Dr. Burt Berkson. He has the entire thing there. You had a paper, the carcinoma. Oh no, that was the kidney carcinoma.
Yeah, that's the recent paper, 2018. on the reversal of a metastatic kidney cancer.
Okay, so you have reversed kidney cancer with alpha lipoic and low dose naltrexone, correct?
That's true.
And are you working on something now?
Yeah, I have a publication. I'm writing a publication now. It's in the hands of my co-author on the reversal of hepatocellular carcinoma on cancer of the liver.
Right. And so you're successful with cancer of the liver in some cases.
In some cases, yes. And
Okay.
probably with the liver, we have better luck than anything else as far
Why
as
is that?
cancer.
Why is that?
I guess lipoic acid really stimulates good liver regeneration and kills liver cancer cells.
Okay. I want you to say that in a more, or let me just rephrase it for the people. Alpha lipoic regenerates the liver cells, correct?
Yes.
Okay, so when I'm working with somebody or I'm trying to explain to someone, read the science, and they come back to me, even though I've said it many times, or maybe we speak for 6 months and we work with each other, they get scared because their doctor says, oh, you're going to have to go back on the drugs because you're getting cirrhosis and you could die. And I keep on saying, Dr. Burt Berkson's research explains that alpha lipoic regenerates cancer cells. Correct?
Correct.
So alpha lipoic regenerates cancer cells and reverses cirrhosis into pink livers.
It sure does. And if you go to PubMed, you type in alpha lipoic acid liver, you'll see lots of publications from all over the world. You type in lipoic acid, cancer, you see publications. You type in lipoic acid, diabetes, you see the most publications.
Oh, fabulous. Yeah, diabetes is beautiful.
In fact, in Europe, lipoic acid is called thioctic acid, and it's a prescription drug.
Really? I thought they
Yeah.
could get it over the counter in Europe.
I don't know, but I know it's
Yeah.
on their formularies.
Wow, that's even better. Now, I didn't realize that, so I can tell people in Europe that they can go to the doctor, but the doctors don't know it in Europe. They really don't. I mean, I can't tell you how much I've tried to tell people, just talk to your doctor and maybe they know about it. Okay,
Well,
so
wait a minute, Denise.
what?
I'm not against conventional therapy if it works. I do a lot of conventional therapy. I just don't do the conventional therapy that I've found over the past 45 years don't work.
Right. Oh, I'm very with you. And if there's medicine that you need desperately, yeah, sure. I'm all for it because you need to stop the bleeding. But if you can take something like an alpha lipoic that can reverse the liver and reverse the cirrhosis and then make you healthy, then why would you need a liver transplant? That's all that I'm suggesting. That try the alpha lipoic.
Well, if the patient was my patient, and I'm not telling other doctors what to do, but if it was my patient, I would tell them to try this first, and then they could always do a liver transplant if it doesn't work.
Right.
But it usually works, by the way.
And you know what? Everybody is different and everybody gets polluted different ways. And you never know which way they're polluted until you dig deep and you have that consultation with them and then you figure it out. Because oftentimes, and I double checked with you, but oftentimes autoimmune hepatitis I found is misdiagnosed when it's only Candida. And if it's only Candida, then the alpha lipoic is not going to reverse it completely. You need to go to the Candida diet, incorporate that along with the alpha lipoic, and then it does work. And I think you told me that you've worked with Candida also.
Well, Candida is a fungus. It's a yeast. And when it grows, sometimes it's a mycelial fungus, sometimes it grows as a yeast.
And it hits the liver.
And sometimes it reproduces sexually and looks like something else.
And so just going on to the next thing, I wanted you to talk about your research, because I know that you usually research other things. Have you found anything else that thus far, has helped as well as alpha lipoic?
I've found nothing that works as well as alpha lipoic acid. And it's, you know, it's something that our body knows how to use if it gets it. It gets it rejuvenates every cell of the body by stimulating normal mitochondrial activity.
Okay. Now I have some good questions for you. Unfortunately, Facebook knocked me out, so I couldn't take those questions live. But I'm always thinking about how you could help with alpha lipoic, because I know that I contacted you recently when I was in a stressful situation. Somebody I knew close to the family had a stroke, and you said if they could get an IV of alpha lipoic, it would help regrow the brain stem cell. Would you like to elaborate on that?
Well, you know, in Russia, there's some publications when people have strokes, embolic strokes, or heart attacks, myocardial infarctions, and they've hooked people up to intravenous alpha lipoic acid, and it seems to open up the blood vessels and stimulate new growth of normal tissue if it's done early enough. And lipoic acid stimulates nerve cells to regenerate. In fact, most of the publications on nerve cell regeneration have been with diabetic neuropathies. People with diabetes often have a lot of pain in their feet because the nerves in their feet tend to die, and because the blood vessels become clogged up with plaque. Most of these publications, and there's several of them, and you can find them all on PubMed, done at big institutions. Let me add that several years ago, in 1983, one of the most prestigious places in America called me up and said that they heard that in Europe they were using lipoic acid for the reversal of diabetic neuropathies.
Right.
Would you teach us how to use it? And I did. And then a few years later, I read this article that these people have taken, I think it was 1,200 people with diabetes who were possibly amputation patients because of their toes were so infected, so affected by neuropathies. And they gave them intravenous alpha lipoic acid for 3 weeks, 5 days a week for 3 weeks. Within 3 weeks, they grew new blood vessels, new nerves in the toes, and had normal endothelial and nerve function to the feet.
Wow. Wow.
Yeah.
So it saved the 1,200 patients.
And they did this, and it's all published. You can find it on PubMed. And they never continued with it.
Wow. Wow.
They cut off a lot of toes over there.
Oh, that's terrible. So just for the sake of following up on that piece, the 1,200 people who have diabetic neuropathy, they got alpha lipoic IV 5 days a week. How much do they usually get in the IV? Is it 300?
No,
Is
I
it
think
100?
I think it was 600 milligrams IV.
600. That's a lot in your IV. Okay, that's strong. That's a beautiful thing, and that helped them.
Of course.
Wow. Wow. Okay, going forward, let's talk about what people should use. Well, what is the average? It's not like you can't tell everybody what to do because everyone's so individual and you have to see them individually to find out what their needs are. But in general, if a person is getting older, at about 45 years old is when you say people should start supplementing with alpha lipoic just for good health. Is that correct?
Yes, and you know, if you go to PubMed again and you type in alpha lipoic acid, comma, telomerase, you'll see something very interesting. Lipoic, you know, telomeres are these this material at the end of each chromosome.
Yes, I study them.
And as we grow older, these telomeres become smaller and smaller.
Right.
There have been studies giving people alpha lipoic acid, and they seem to lengthen their telomeres.
Yay!
And decrease telomeres is a sign of aging.
Right.
And this causes the telomeres to build up again.
Wow, we're going to live forever, you and I. I'm going to do this radio show in 20 more years, and we're going to be like, I have to ask you though, is that with IV or oral alpha lipoic?
Well,
And
if you give lipoic acid IV, I mean orally, it goes into the digestive tract, and it goes from the digestive tract straight to the liver. So the liver gets very high doses of it.
Okay.
But you get a little bit into the bloodstream.
Okay.
So lipoic acid orally really helps the liver.
Okay.
If you get it IV, it stimulates very healthy liver health. Goes into the brain. It goes across the blood-brain barrier. Goes into the eyes, the inner ear.
Wow.
In the lungs, the pancreas. Every part of the body becomes infiltrated with the alpha lipoic acid.
Okay.
Stimulates the mitochondria
So
to produce energy, and stimulates normal regeneration.
So do the telomeres grow because you're taking alpha lipoic orally or IV? I want my telomeres to grow.
I think IV, it works better, but it probably grows to some extent orally too.
Okay, and how much? 600 milligrams?
Well, you'd have to read the article.
Okay, but you recommend 600 milligrams for the average 45-year-old who's not producing.
Depends on the patient. I myself take 300 milligrams twice a day with meals.
Yes, me too.
And by the way, if you take alpha lipoic acid, you have to take a B complex with each alpha lipoic acid capsule.
Yes.
Because the B complex vitamins are depleted when you take alpha lipoic acid.
And is it all B complexes, or is it B1 and 6 only?
I would take all of them.
Okay. Now, let's talk about quality of alpha lipoic, because I keep telling people, stop taking the cheap alpha lipoic from China, but it's FDA approved. No, 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 no. Dr. Berkson says you got to get it from Europe. Talk to me about why.
Well, I don't know. You know, there might be some Chinese companies that make very good alpha lipoic acid, but the original products were European.
Okay.
The original product was from a company called Asta Medica, and I was a consultant to the company for several years. You know, I was the Food and Drug Administration chief scientist for alpha lipoic acid for 23 years, and because I believe because it has so many indications and it's so simple and it's so difficult to get it patented, no drug company was interested in it.
Yeah, I can see that. I can see that. Okay, going forward, so much information to cover, because I want to talk about the other indications for alpha lipoic. So we know it's great for diabetes. We know it's great for diabetic neuropathy. We know it's good for just simple aging. So that's why my face looks so good, almost 60 years old. I'm taking alpha lipoics for the last 6 years. But also, it's good for liver regeneration, rheumatoid arthritis. Lupus is the one that I was surprised with when you told me. And I want people to know that you also work with lupus patients and successfully.
Wonderful, wonderful results with lupus patients because we give them low dose naltrexone.
Okay, good. Tell us about low dose naltrexone, because many people that I work with need to get it. And I can't explain why, because I'm not well versed in low dose naltrexone. Could you give people the general idea of why it's so successful?
Well, low dose naltrexone is a prescription drug, and you have to get it from a compounding pharmacy. And if you take it at bedtime, it fools the brain into thinking there are not enough endogenous opiates in the body. So in the morning, your brain and your spinal cord secrete these endogenous opiates, and also your adrenal glands. And that gives you a feeling of well-being,
Mhm.
but it also downregulates the inflammatory cytokines, which cause the lupus and rheumatoid arthritis and MS and all these other diseases.
So it helps
Lots
with,
of publications.
okay. And the milligram is everywhere, anywhere from 1 to 4.5 milligrams?
It reverses autoimmune disease as long as they're taking it. In many cases, sometimes it doesn't work.
Aha.
And some people take 1.5 milligrams. Most of my patients take 3 milligrams. Some take 4.5.
Okay. You just have to figure that out with your doctor. Um, let's talk COVID since we only have a few, like 15 minutes left. And I know that your state, New Mexico, really does not have too many COVID cases where we have a lot in New Jersey, New York. We're definitely calming down and there's fewer and fewer. But there's a tremendous fear out there. I mean, I'm not afraid because I take so many vitamins that I just figure, well, I'll be fine if I get it. I'll survive. It may not be fun, but I'll survive. So my question to you is, what would you suggest to your patients during this tumultuous time?
Well, I would take my vitamins and eat properly. And if I was a person with a disease process, or for example, somebody being treated for cancer, or someone who has bad COPD, chronic obstructive pulmonary disease, or uncontrolled diabetes, if I was over 65, I'd stay in the house most of the time.
Okay, but if they want to take something prophylactically to get to prevent it from harming them,
I'd make sure that you got enough zinc.
good. What about HCQ?
Hydroxychloroquine, well, it's a prescription drug.
Mhm.
And I know I've written it for, I've wrote the prescriptions for a few people.
Mhm.
And the pharmacists called me up and said, we can't fill these prescriptions.
Oh,
I said, why not? They said, the government says we can't.
oh no, oh no. Even in your state?
Yeah, yes.
Okay, so when you and I were talking last month,
Wait a minute, unless we're giving it for lupus or rheumatoid arthritis, but not for COVID.
interesting, interesting. So just again, prophylactically, if we wanted to stay strong and healthy, I always tell my clients and my viewers, vitamin C, vitamin D, zinc, and high doses, and selenium, because selenium is a viral killer.
Sure does. Dr. Will Taylor wrote several publications showing that selenium is like a birth control pill for viruses.
Ah,
When the selenium levels are high, the virus has problems regenerating, replicating.
mhm.
When they're low, the virus can often go out of control.
And where's Doc? I'm gonna put on the bottom of the page of our underneath the YouTube channel the Dr. Will Taylor's research. He is in which state? Which university?
When he did this, he was at the University of Georgia. Now he's at the University of North Carolina.
Okay,
He's a virologist.
okay. I'll put the link for his research underneath the page later.
Yes.
And again, you are presently you're currently working with, you're writing a paper about liver cancer. So your liver cancer paper is doing what? It's talking about what?
Well, this is a middle-aged nurse who was a smoker, and she was very depressed. Her husband died, and other family members died. She's working at a university intensive care unit. And she had a finger stick and developed hepatitis C and didn't take care of herself. She worked very hard. She didn't get enough sleep. She smoked. She had a terrible diet. And she developed a liver cancer, hepatocellular carcinoma. And she went to the hepatologist, the liver experts at her university hospital, and they told her that nothing really could be done for her stage except for a liver transplant, and maybe that wouldn't work either. She came to our office and we put her on intravenous alpha lipoic acid 2 or 3 times a week and a low dose naltrexone at bedtime. And she started feeling good right away, and a good diet, by the way, and vitamins and minerals. And within a short time, her liver started getting better, and we did PET scans and CT scans all along. And within, I think it was 2 years, there was no sign of liver cancer.
Ah, so beautiful, so beautiful.
So she continued for a while. And then, of course, she thought she was cured and stopped all treatment. And then her daughter called me back a few years later and said she went back to smoking and eating the way she did and stopped all of her vitamins and minerals.
I
The
hate when
cancer
people
came
do that.
back and she died.
Yeah, I know. My friend did that too.
So we don't cure anything, but while they're doing treatment, people often do well.
Okay, before we go, can you just give me your rendition of diet? When you say it should, because I can't tell you how many people tell me, my doctor said the diet doesn't matter. I'm like, oh my God, please. Okay, so then just don't eat the junk food and go and have organic farm fresh food. But what do you tell your patients in terms of a good diet?
Well, what's really interesting first about eating sweets. I was at a conference, a big conference on oncology not long ago, and when I walked back past the booth of a very large cancer center in America, there was a young woman there who I was talking to, and she took out a tray full of Snicker bars and Three Musketeers and M&Ms.
I've heard this before.
She said, take all you want, just stuff it in your pocket. And I said, I see, it's very unusual, I think, for an oncologist to telling people to eat a lot of sweets, because, you know, cancer needs sugar to grow.
Yep.
They grow on sugar. It stimulates cancer growth. She said, well, nobody's ever proven that.
Was she a doctor?
A board certified oncologist. I said, what about Otto Warburg? He won a Nobel Prize for this research. She said, well, I've never heard of him.
I'm just stunned. I'm like, I can't believe people actually say this.
I said, let me ask you a question. Do you know what a PET scan is? She said, of course, we do it all the time. So what is a PET scan? Well, they take sugar and inject it into the body and with a radioactive molecule, and it goes right to the cancer cells and they gobble it up. Oh my God, I never thought of that.
Oh my God. Oh my God.
I mean, you know, a lot of doctors don't think out of the box. They just are trained to do something and they do the same thing all the time.
Unfortunately, the same goes for your television news anchors. They just follow the rules. They don't think out of the box. They just copy what's on the AP Newswire, and they never get the right news. And that's why they call it fake news. It's just because it's not true. It's all fed to them by an organization that wants you to know what they want you to know, and they don't want you to know the truth. That's why I'm doing this radio show. I want to tell everybody the truth about getting better, about healing. Food matters, vitamins matter, and so does the belief, or at least if you're not going to be connected to or believe in God or a higher source, then believe in the quantum field and the energy around you that you can actually transmute by your positive thought process. That's just called quantum physics, and you can read about it if you don't believe in the God source. In the meantime,
mind, body, medicine.
Amen. And so just briefly, what do you tell people in terms of their diet? What do you prefer to tell people to eat?
Vegetables first, green vegetables first, broccoli, cauliflower, cabbage, spinach,
Good.
very important.
What about your proteins?
I think people could eat meat, but I think they should limit it. And I think everything should be organic.
Amen. And fruits?
I think fruits are fine, but we often see people with their very high blood sugars from eating too many fruits.
This is true.
Fruits are
But
very healthy,
you have to balance
especially
your meal.
blackberries and blueberries, things like that.
Yes, the antioxidants. Yes, exactly. Okay, so one last thing. I want to talk about your books. Everybody should be reading as many of the books that you publish as possible, because you bring more information to the average Joe than they will find on the bookshelf in Barnes and Nobles, or people not going there. They're going to go to Amazon. They're not going to find your books because they really do stifle. Amazon stifles the holistic health writings, so they can't find you so easily. So please give me some of the books.
I think they can. All they have to do is go to Amazon.com.
Right.
Type in Burt Berkson.
Okay.
And 3 books will pop up, at least 3.
Yes.
One is the Alpha Lipoic Acid Breakthrough,
which I have publicized.
Another one is Syndrome X. This is the first book on metabolic syndrome and prediabetes. And the third is all about the B vitamins.
Okay. What's the third book called?
All about the B vitamins.
I haven't bought that book, obviously. But so Alpha Lipoic Breakthrough is the #1 book that I suggest that people buy. Obviously, Curing Courtney, my book, is the one that I suggest they buy first. And then Alpha Lipoic Breakthrough. And of course, there's many different diet books, but specifically I like Wheat Belly, because I tell people no wheat, because wheat turns to sugar, and we want to really and it's also inflammatory. And I have found, I don't know if you have, I'm sure you have, I have found that people get triggered. Their liver gets triggered when they have wheat. And I can't tell you, there's another person that I lost. I didn't lose the child. They stopped listening to me. She was doing great for 4 months. And 5th month or something, they got all comfortable and they started feeding the kid, and the father started baking for the child the wheat treats. And of course, the child's just child. So she's eating whatever daddy gives her. And she got worse. And she got so bad, they put her in the hospital and had to give her an IV of steroids, because the father would not listen. And it was so frustrating that I had to wash my hands of it. I just cannot go to your house and feed your child. You have to stop doing what causes the AST and ALT to go up. And this is something that was very frustrating. But I emphasize, please stop eating the wheat and eat your green vegetables and your meats and your proteins and your fruits, obviously, low glycemic fruits. But you really have to stop eating the wheat because it causes inflammation. That's from me. Dr. Berkson didn't say it, but I usually suggest no wheat.
Some people have problems with wheat, but it's very difficult to get off wheat.
Yes, it is. They make it like an opiate to your body. I understand. Anyway, I wanted to thank you so much. Is there something else that I've missed?
No.
Okay.
You know what? Are you familiar with Julia Chopek's books?
Julia, sure. I love Julia. Honest Medicine was the first book.
Honest Medicine is a fantastic book.
Honest Medicine is one of the best books. I read it first before I wrote my book. And Julia then guided me on as to what to do and how to get the book published. But she is fantastic. And Low Dose Naltrexone is, that's the book that you read when you want to learn about low dose naltrexone. And Dr. Burt Berkson wrote a chapter in that book.
course.
How many chapters? One chapter?
In Honest Medicine.
Yes. I didn't know how many chapters you wrote.
I think I wrote one, but I may have wrote part of another one too.
Yes, absolutely. Anyway, I want to thank you so much for being here. Dr. Burt Berkson from Las Cruces, New Mexico, and Dr. Arthur Berkson, who now runs the business, right?
He is the boss.
He is a brilliant boss. I mean, I've heard you talk to me about him, but also I send people to your clinic and they tell me how fabulous Arthur is. And also, I just recommend going there if you're nearby. If not, we can help you. Find somebody. If I can't help you with a food, just a protocol that is oral, then I will recommend people that might be near you if you can't get to Dr. Berkson's office. In the meantime, I want to thank you so much. You've been so wonderful and generous with your time.
Thank you, Denise.
Absolutely. And next week, I'll have another doctor or a scientist to talk about how to heal. Again, don't forget to take your vitamins, take your D, your C, your zinc during this COVID period, and don't forget to take your selenium too, at least 400 micrograms, according to Dr. Berkson, right? Also, stay happy, happy, happy. Eat well. Eat like a farmer, an organic farmer if you can, and try to stay off the wheat and the sugar. And please find a way to keep yourself happy during this time. It's a very tumultuous, emotional time for so many people. Just appreciate everything that you have. Stay happy, happy, happy. I love you all. I'll see you next week. Bye. I have to put the glasses on to stop this.